Okay. Hi, everyone. Can you hear me? Can you see me, please? Good evening, Praveen. Hi, good evening. Good evening, everyone. All right. Hi. So, we will begin the dermatology session, the last 3 years NEET questions. Okay. First of all, before we even begin, how have all of you been doing? Tell me if you're doing good, you're struggling. Are you having difficulty in concentrating? Are you feeling a bit of panic? Are you feeling a bit anxious? Are you feeling the weight of expectation, the weight of 19 subject which you don't ever seem to remember and you seem to forget faster than you can memorize them? Is that not what you're feeling? Or are you feeling confident and upbeat? You feeling good? Disheartened? Yes. I before I even begin this session, I want to just give in a word for how do you deal with the disappointment of INICT. Okay. Meditations, actually, thank you so much. Some of you have mentioned the meditation session which seeming to be good. Yes, I will also do some degree of motivation today. I think that is the need of the hour. NEET exams and the MCQs, yes, they are important, but I feel what most students need at this time, apart from a good PYQ discussion, is also a discussion on how to handle the last 1 month with a lot of effort, and that effort is unfortunately going away because most of us are anxious, most of us are panicky, most of us are feeling that it will not happen, and that negativity that's creeping in, and the disheartenment because the INCT, many of you would have worked very hard and then still things didn't go according to plan. Obviously more people will be disappointed than people who will be happy with the NEET exam. Obviously that's the nature of the exam, and many students will say that, oh, if INCT is so close to NEET exam is not giving me, how can I hope to improve in the last 1 month? Tell me if that is a wrong assessment. It's an assessment which as I'm talking from experience. Now a lot of students will message me ki, sir mera kya hoga, right? Mera kya hoga, right? And this is really something that we will speak about. So let me do the neat questions, and then maybe at the end we'll speak about how do I feel your day should be, and how do I feel your last 1 month's preparation should be, so that again should be able to solve that kind of a thing that's really creeping in, right? Okay, so let's begin. Okay, let's begin with the latest year. Let's begin with the latest year. Okay, 23, right? Okay, chalo, let's begin with this. Okay, these are the actual questions. Obviously most of them are recall questions, but now because we cross check many times, so then usually they are correct now. Okay, a woman with multiple ulcers, okay, multiple sexual partners, okay, now comes with painless, okay, 1 second please, comes with painless, give me 1 minute. Okay, comes with painless irregular ulcers and painless lymph nodes. The diagnosis is, so whenever you have a STD question, okay, I'll come back to the question. Whenever you have an STD ulcer question, okay, whenever you have an STD ulcer question, okay, most ulcers can either be classified as painless ulcers or obviously as painful ulcers, right? Whenever you have painless ulcers, whenever you have painless ulcers mentioned, okay, listen to this, you always check for lymph nodes. Which lymph nodes? You always check for inguinal lymph nodes. You always check for inguinal lymph nodes and what it says. If the question says there is a painless, see the word please, painless inguinal lymphadenopathy, painless inguinal lymphadenopathy, not lymphadenitis. See the words please, not lymphadenitis. If there is no itis, when there is no itis, there is no pain, and that's why it's painless. Right? Clear please? Right? Okay. Now this lymphadenitis means there is no bubo formation, but there is still a swelling of the lymph nodes, right? This is a classical diagnosis of syphilis. The ulcer will be a syphilis, very classical, okay? And we, as we do in the class, we always put this as syphilis, okay? Less means everything is less. Painless ulcers, painless lymph nodes is what you would talk about when we talk about syphilis. See, one thing I can tell you, bache, when we are doing a discussion in this calm environment, in aram se sitting in your own house, you feel that it's simple hai, we remember it very well. But guess what? The same question, many students are making a mistake in the stress of the exam because they have to hurry up to the next question. Especially with the time bound scenario now, it's so easy to skip to the next question. And then what happens is your mind is already skipped to the next question. Tell me if I'm wrong on that. Your mind is already skipping to the next question, and in the present question, because you somehow feel it's so easy, many students say, अरे बड़ा easy था. अरे एग्जाम के अंदर easy नहीं होता, एग्जाम हॉल के बाहर बहुत easy होता है, सब कुछ easy होता है ना. Inside you will feel a bit of trouble. So please always remember that the maximum issues come in the simple questions. I know people lose their rank and their career just because they make a silly mistake in a simple question and they know that, and ultimately वो गलत हो जाता है कि नहीं? बताओ अगर मैं गलत बोल रहा हूं तो. If you make a mistake in the hard questions, it doesn't change your rank too much, right? But if you make a mistake in the simple questions, your rank changes big time. So I always have this something called as a red antenna. The red antenna means when you're giving an exam, always remember, when you're giving an exam, whenever you have a simple question, your red antenna should come up. The red antenna means I can make an error here. Understand what I'm saying? Okay, so don't take a simple question casually is my fervent desire for all of you, right? Okay, now if the question says in the lymph node there is no lymph node involvement, okay, in fact there is a granuloma in the inguinal region, okay, then this is called a pseudobubo. Okay, this is called as donovanosis. Okay, donovanosis. Clear? Now, if there is bilateral lymph nodes with a bubo formation, okay, then this will be called as LGV, lymphogranuloma venereum. Okay, so there's going to be only 3 differential diagnoses for a painless ulcer, right? And you have to then differentiate from the lymph nodes. Okay, now if they're painful ulcers, you will only look at chancroid and you will usually look at herpes simplex virus, है ना? ठीक है. Now in this, usually you will talk about vesicles, and that too grouped vesicles, and that too painful vesicles, and then they lead to ulcers. Okay, they'll have a bubo, that is a painful ulcer, but they'll also have a bubo. Okay, chancroid also has a bubo. Clear? Okay, clear? Everybody got this? Yes or no? Clear? Okay, so now you have to know chancroid is a bubo, herpes is a bubo, but herpes is vesicular, chancroid is non-vesicular. Okay, clear? Okay, now let's go back to this question. Okay, painless ulcers and painless lymph node. Now tell me the diagnosis, bache. Painless ulcers, painless lymph nodes, and obviously this should not be a problem. This is syphilis. Clear? Painless ulcers, painless lymph nodes, right? Should be syphilis. Chancroid will be painful ulcers, as we just said, and painful lymph nodes, right? This will be painless ulcer and no lymph node. Yes or no, bache? Everybody okay with this? Batao. Now this has no relation to STD. So when you say multiple sexual partners, that should be going away right there. कोई दिक्कत नहीं, ठीक है? Okay. Yes, Hajira, I can understand, bache. Anything which is first time is going to make you nervous, right? Will make you nervous, right? Don't worry. We'll work on that. Okay. All right. Now next question. A 35-year-old obese woman present with acne is given in the image. There's an image. Let me zoom in on the image. There's a bit of acne, right? There's a bit of hair, which is now called hirsutism now. Okay. Hirsutism is basically a thick hair. Hirsutism is basically a thick hair, and this is what we call as lower face acne. Always remember that whenever you think of acne on the lower face, you think of PCOD. PCOD, a good sign for PCOD is lower face acne, okay, and a bit of hirsutism, which is thick facial hairs, thick facial hairs, okay. Now PCOD always has a component, PCOD always has a component of insulin resistance, and this insulin resistance always gives her some degree of obesity, and that will be usually a body mass index more than 25, a body mass index of more than 25. Okay, bache? Okay, so let's get back to the question. Obese woman, so that obesity is something that you can observe here. So likely a BMI of more than 25 according to the Indian guidelines. Okay, the American guidelines will have a BMI of more than 30 as the obesity guideline. For us, it can be lowered because we tend to have more insulin resistance. So our guidelines are lower, right? So a BMI of 25 for us will give us as much trouble as a BMI of 30 for a Westerner, right? So we become sicker with much less weight on our bodies as compared to a American. Acne given in the image, lesion not respond to, obviously it will not respond to antibiotic because it's a hormone, it's a DHT driven process. So even if you give doxycycline, doesn't work. It doesn't work with isotretinoin because obviously the cause is hormone. What is the next step? Now this seems to be a logical option, but obviously it's not true. Look for triggering drugs. Drug induced acne is not. Drug induced acne is also called as acneiform eruption. Okay, drug induced acne is called as acneiform eruption, which usually is what we call as a monomorphic rash. क्या बोलते हैं? Monomorphic papules. Okay, just a small dot 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 kind of papule, mainly on the chest and the back, and we don't expect hirsutism to come in a drug induced acne. Drug induced means steroids, for example, or anti-TB therapy, for example. Look for dietary triggers. Look for hyperandrogenism. Should be the, obviously it's an androgen driven process, right? We know it's an androgen driven process, so obviously it's going to create that particular trouble. Now it's a myth that oily food creates acne and all that stuff. So that's something that is usually people believe in that. Because one of my patients said, oh ना ना हिंदी में बोलूंगा कि ना ये खाना मैंने खाया, ये खाना खाना ना मेरे को हजम नहीं हुआ, मेरे को गर्मी हो गई. That's the Hindi word, and sometimes it's laughable when they say that. गर्मी का मतलब क्या होता है? You think this is गर्मी? They say, oh no, I had a lot of mangoes, no, and obviously then this is coming out. So all these dietary triggers don't really make a lot of direct sense. It's actually a hormone driven process. So obviously you want to look for androgen receptor inhibitors as the therapy for this condition. So obviously the drug that you would give here is maybe an oral contraceptive pills. You might also look at spironolactone. You might look for a lifestyle change, okay, and some metformin, especially if there's a lot of insulin resistance creeping in, and that could be something could be done. For the hirsutism, you have to do LHR, which stands for laser hair reduction. The common laser used is a diode laser, usually diode laser. Just give me 1 minute, bache. Just give me 1 minute. Okay, so right, so this is going to be LHR, the diode laser that you could do, right? This is the usual treatment for polycystic ovary disease, right? Polycystic ovary disease. Spironolactone, which is an androgen receptor blocker. Okay, this is an androgen receptor blocker. Does stress cause acne? Not a direct relation, bache. Can benzoyl peroxide? Yes, obviously benzoyl can be given, but not directly impacting hormonal acne. Hormonal acne needs a more, more holistic kind of a management. Okay, right. Okay, all right. Now, diarrhea, dementia, dermatitis. Now, this is a straightforward question. Should not be a worry at all. This is pellagra, right? And this is actually a biochemistry question, but still we are dealing with here. Okay, pellagra. Okay, obviously a niacin deficiency. Now, this niacin deficiency makes the person photosensitive. Okay, makes the person photosensitive. Okay, so what happens is, if this is the body, the patient is photosensitive, so this area, the V part of the neck, which is usually sun exposed, starts getting a bit of inflammation, and this inflammation is a V-shaped inflammation, which is now called a Castle necklace. Castle necklace. Okay, it's a necklace, it's a V-shaped structure because the patient is obviously photosensitive. So 3Ds we know, right? Diarrhea, dementia, dermatitis, and death. The fourth D, straightforward question, should not even be a bother. And it's usually seen many times in alcoholic people who tend to have multi-nutritional deficiencies. The only thing they have is alcohol and maybe some stuff, some food, some selective food alongside, but not really a proper nutritional diet. Should be a simple question. Okay. Now, fourth, an HIV adult male presents with hilar lymphadenopathy and lung involvement with facial lesions. Okay, now when you look at these facial lesions, okay, let me zoom in. Now, can you see a black something in the center? Okay, there is something in the center, right? Almost as if there's a volcano and there's a small, something like a crust, some kind of a boulder, some stone in the center of that volcano, that kind of appearance. Look at this also, right? Something center mein, there's a papule, right? The papule. So I'll show you what I mean by this. So there is a papule, right? And something sitting here, that kind of appearance. Are you understanding this, please? Okay, so this has been called as an umbilicated papule. क्या बोलते हैं इसको? Umbilicated papule of dermatology. Okay, now this umbilicated papule is seen in three causes. If there is no internal systemic involvement, okay, mentioned, okay, there is no systemic involvement mentioned, then you will answer it as molluscum contagiosum virus. Okay, if there is a mention of lung involvement, okay, hilar lymph nodes, then you will mark it as histoplasmosis. Histoplasmosis. If you have a CNS involvement, some meningitis features with the same appearance, then you will call it as cryptococcosis. And these two seem to be what is called as ADC. ADC stands for AIDS defining illnesses. ADC stands for AIDS defining illnesses. Okay, AIDS defining illnesses, which means that you will find that they are AIDS defining. AIDS means the end of the HIV process. So when the CD4 is really low, then this cryptococcosis can become disseminated out of the CNS, and it can create skin lesion which almost looks like molluscum, right? So you will answer this tricky question as not molluscum, not crypto, but histo. Yes or no, everybody cool with this? It is not a straightforward question. This was a question which is out of the box question, right? Okay, clear? Right. Okay. Now a wife of a long distance truck driver has cervical erosions, vaginal discharge, and dysuria. Now, why you say long distance truck driver? Now, these people are prone to STDs for the simple fact that driving is a very lonely, boring business. Imagine driving a truck for 10 hours on the road without any change. So it creates, and we know this for a human, it creates boredom, it creates loneliness. It what happens because of that, as you know, they don't have any Netflix to kind of unwind in the night. You can't order a Zomato on the road from a truck driver. So what do they want to do for unwinding? They actually have sexual activity at the end of the day when they want to relax. There's an entire business of that around a truck driver's terminal. The truck resting places are very common times where they get an STD and they will bring it back to the wife when they go home. And that's what the scenario is, right? Cervical erosions, vaginal discharge, and cervical erosions, vaginal discharge, and dysuria. Okay, dysuria. Now, what happens with this is, see, whenever you talk about vaginal discharge, okay, vaginal discharge, okay, what are the causes then? We know Candida is a discharge, we know Trichomonas is a discharge, right? We know Bacterial vaginosis is a discharge, right? That's a vaginal discharge. When we talk about cervical discharge, it will be gonorrhea and it will be chlamydia. Okay, the gonorrhea and be chlamydia. Okay, now listen to this very carefully. Now listen to this very carefully. Okay, this question was actually quite tricky. This question is actually quite tricky, and one thing I can tell you is many faculties gave varied answers to this. So it was a tricky question, I have no doubt about it. Okay, now when we talk about vaginal discharge, but there's a cervical element to it. There's a cervical element to it, right? So we will usually look at cervix as the origin of this problem, and then the vagina becomes the secondary pathway for the discharge to be coming out. Okay, so we look at this as a cervical thing. Not even though it says vagina, you don't look at vaginal thing because there's a cervix mentioned. Okay, now I accept completely that some people with trichomonas, okay, can have some degree of cervical involvement like strawberry cervix and punctate hemorrhages on the cervix. I accept that, but that's too far-fetched in my mind to look at it that way. So if I were to be in your place, I would look at cervical as the, but I accept that it's going to be slightly controversial. Some faculties did answer it as vaginal on this, and they said no, trichomonas can create this. I was somehow not very agreeing to this. I still would go for gray, but as I said, there are two ways to look at this question, and I would not really like this question so much because there is some degree of ambiguity. It's not like a black and white question. There's a shade of gray, but I would mark it as personally a gray kit. Okay, all right. A patient comes with lesion has shown the long-term complication. Now this was a relatively simpler question, and we have done this so many times in the class. It's a large it's a large congenital melanocytic nevus. Okay, right? Clear? Large congenital melanocytic nevus, a long-term complication. Now, whenever you have any lesion which is very, very large, okay, you have to look at this, okay, malignant melanoma. Malignant melanoma. Now, some students marked it as, oh, it's around the eye, so why not call it cataract? No, it is a melanoma. It is a melanin tissue. So the complication will also be of melanin only now. So melanoma, and we have done this in class many times. If you have a large, see, if you have a small CMN, then there's no chance. It's usually a benign lesion, but a large CMN is definitely got some degree of, the larger it is, the more chances for malignant change it can actually have. Are you with me, please? Everybody got this? Yes. So this was a tricky question because the site was around the eyes. So many students by default चढ़ा रहे कुछ, ये तो ऑफ्थैल क्वेश्चन है, चलो कुछ ना कुछ आंख का तो होगा, तो किसी ने कैटरैक्ट मार दिया, किसी ने लॉस ऑफ विजन मार दिया, तो वो तुक्का था. right? This is not something that we would need to understand. Got this, please? Yes. Okay. Yes. Okay. Now there was no blue sclera mentioned. Okay. When there's no blue sclera, it is not supposed to be nevus aorta. Nevus aorta would usually have a blue sclera alongside, which is doesn't seem to be the case here. Okay. Okay, clear? A patient with multiple sexual partners comes to you. His smear shows an image given below. The treatment for this would be. Now, what are you seeing here? Can you not see gono here? Gram negative diplococcus. Now, multiple sexual partners comes. So, in the 23 exam, there was a significant focus on STDs. Can you see a good number of questions on STDs, right? Okay, it's obviously a important thing, right? His smear shows this, we know. So obviously the answer should be ceftriaxone. Answer is ceftriaxone, usually 500 milligram intramuscular single dose. Or you could have also given cefixime orally, 800 milligrams stat. Okay, clear? Okay, so we don't give any of these drugs, obviously. है ना? Now there's one recent INICT this time, okay, 24. Which agent in STD has the most multi-drug resistance? More assistance? The answer should be gonorrhea again. Okay, gonorrhea again. Now there's a lot of MDR. Now, in fact, now sometimes there are even strains resistant to ceftriaxone and cefixime also now, which is now very scary proposition. It's almost becoming like tuberculosis. Yeah, and this resistance is really creating a havoc. So this was your INICT, just the recent INICT. Okay, right, done. Okay, is it getting stuck or is it okay? Buffering. Okay, 1 second. Then 1 second. 1 second. 1 second. Okay, I'll change the internet sources. 1 second, please. Is it okay now? Just tell me. Now okay? Is it okay now? Yeah, okay. Good, good. Okay, chalo, chalo. Okay, okay. Right. Now, eighth question. A child with poor healing comes with perioral lesions. The diagnosis is. Now, see this very classical. This is a new question for you. Again, a biochemistry question. This is a disease called as acrodermatitis enteropathica. Acrodermatitis enteropathica. The word acro means acral. Okay. So there's going to be a hand, foot, and even the mouth and perioral area, which will show us erosions, okay, and lesions around the mouth, which you can see in this image. Okay. Now dermatitis, okay, matlab inflammation. Enteropathy ka matlab diarrhea, some gut changes and atrophy of the villi, and that's usually a zinc transport deficiency. The zinc is not getting absorbed because the transport protein doesn't seem to work very well, and that's why it comes in children, especially during the weaning period. Okay, where they start taking oral, feeds, they might be deficient in zinc, and they might create this problem. So a lot of vitamin questions in 23 overlapping with biochemistry. Aesthetic questions is what 23 actually focused on. There was no question on leprosy. So you never know how what NEET can give you, but we already know that these topics are always covered in your exams, so we don't really worry about it so much, right? Okay. Ninth question, a patient with a recurrent user of hair dye. She comes with allergy. The image. Now, if you look at this image, it almost, and this is a trick question, okay? This almost looks like angioedema, okay? This looks like angioedema, but it is not. It's a trick question. Okay. Now see this history, please. Hair dye. Now hair dye has PPD, paraphenylenediamine. Okay. Now PPD causes allergic contact dermatitis of the scalp. Now this creates a lot of fluid in the skin, and what will fluid do? With gravity it comes down, and where will it settle? Eyes. And this edema is a PPD edema. Okay, so even though the image looks like angioedema, don't confuse with the angioedema. This is actually a PPD related problem, right? PPD related problem, and that's typically the allergic contact dermatitis. So 9 questions in the NEET 23 exam, quite a few. In fact, I've omitted 2 or 3 more questions, which was a kind of a fusion with biochemistry, some hair perforation test and all that. So that was tinea. So, but that is something that I will just allow the microbiology person to chip in on that. Okay, okay, bache. हो गया 23 question. All the 23 99 questions in NEET 23. ठीक है, ठीक है बच्चे. All right. Now let's go to 22nd. Okay, 22nd. 2022, sorry, 2022. A patient aged 30 years has a history of COVID 8 months back. She presents with hair loss since 4 months. The diagnosis. Tell me the answer, bacho. Okay, there's an image given. There's an image given. Okay. Treatment is Hemant, yes, bacho. Treatment would be steroids, yes. Okay. Now when you see a COVID history, now COVID is severe febrile illness. Okay. Now we have discussed in class almost after about 3 months of any febrile illness, they start getting telogen effluvium. So answer should be telogen. Even though the image looks like this, I don't deny it. The image does look like female pattern balding, but I would request you to understand one thing, that only an image is not enough to get to the diagnosis. You have to correlate with the history. The history does tell you COVID, and that's why you want to mark. And this is where the errors really happen. So can you see, even though you might know the theory of androgenetic alopecia, you might know that, oh, telogen effluvium, but still patient can make an error. Okay? Patient can definitely still make an error. Sorry, not patients. You can make an error in the hurry of the exam, right? And that's why concentration and focus really become very mandatory. And that's why the meditation session that we're doing every night at 9:45 is just precisely for that, so that you become present moment aware, right? So right now, just go into your head, and then I'm teaching you. So are you fully 100% focused on the question, or are you 90% focused on the question and 10% focused on maybe something else that happened today? Maybe 10% focused on कि मैं कुछ कर पाऊंगा क्या? Oh yeah, I'm feeling panicky. So many times what happens is you're not 100% where you actually are. And that's called present moment awareness, and that's really something which is important, so that those silly mistakes which really hurt and go, that hurt arrow which is because of silly mistakes, right, goes right through your ventricles. It really kills you, because the answer, still you do it wrong, and there's no bigger regret. And that usually happens if you're not concentrating well and you're jumping in your thoughts. So the first thing I want to do in the next 30 days, okay, whatever number of days we have, is to make sure that your focus, you do what we call as focusing practice, you do what is called as concentration practice. Don't really worry about questions as much as worry about concentration and losing that now, right? Clear? Okay. Okay. Many students will say, sir, it is so easy for me to be distracted. Even when students meditate with me, guess what? In the first 5-10 minutes, I'm sure their mind is also still wavering only. Imagine, even during meditation, we can't sit still. Our mind is like a rabbit, it's just jumping all over the place. And then we have to almost pull it back like a pet with a leash on its head. And you'll always struggle with this. So let's first practice some degree of concentration, right? Okay. Right, anagen effluvium obviously will be in chemotherapy, right? So obviously that's not true here, right? Okay. A patient presents with cauliflower-like growth, very standard question. These are called as copper penny bodies. Copper penny bodies. Copper is brown, penny is rupee, brown rupee. The image is like that. and this is actually cauliflower of growth of chromoblastomycosis. Chromoblastomycosis, right? Chromoblastomycosis, right? So let me give you a quick cauliflower mass DD question. Any person who's a cauliflower mass, if the question says coelocytes on biopsy, okay, mark it as a what? Coelocytes are keratinocytes with a perinuclear halo. With a perinuclear halo. If the question says copper bodies, okay, then you mark it as chromoblastomycosis. Alright. If the question says granuloma on biopsy, then you'll answer it as tuberculosis verrucosa cutis. Tuberculosis verrucosa cutis. Okay? If the question says a sinus, lymphatics and nodules, okay, and lymphatics of limbs, this will be sporotrichosis, okay, meaning it'll be a nodule along the lymphatics either of the upper limb or of the lower limb. Sinuses, lymphatics, nodule, will be typical sporotrichosis, and we diagnose it by asteroid bodies, okay, these are these star-shaped bodies typically, also called as Splendor-Hopley phenomena. Splendor-Hopley phenomena, okay, Splendor-Hopley phenomena. If the question says the sinus, okay, local foot swelling, okay, and a grain coming out, you'll answer it as mycetoma. You answer it as mycetoma, also called as Madura foot, which can be bacterial or viral. Okay, mycetoma usually does not spread hematogenously, so there's no metastasis, for example, okay, of this, but it creates local tissue and bone destruction. Okay, locally you have osteolytic lesions which can come with mycetomas on the foot. Okay, so if I go back to the question, it is not mycetoma, not sporo, it seems to be chromoblastoma. Simple question. Okay. Okay, a patient comes with irregular nail pitting. Whenever you have regular nail pitting, we call it alopecia areata. Irregular nail pitting will be seen that in psoriasis. Subungual hyperkeratosis can be seen either in psoriasis or onychomycosis. Okay, the difference, however, will be in psoriasis there'll be a red spot. There'll be a red spot on the nail, and in onychomycosis there'll be a yellow spot. See this, please? Sorry, I have to change the color. Yeah, there'll be a yellow spot on the nail. So that is the two causes for subungual hyperkeratosis. Oil drop is only in psoriasis. So can you see three features? Irregular pitting is in two conditions. Subungual hyperkeratosis in two conditions. Oil drop only in psoriasis. So should be psoriasis. Okay? LP will usually have no pit. It'll have what we call as pterygium of the nail, thin nail, something called as tenting of the nail, okay, tenting of the nail, okay, and longitudinal ridging. So that's the LP feature. Okay, that's the LP feature. Okay, areata we know, LP, atopic dermatitis, not really a lot of nail changes in that. Okay, now onychomycosis typically will be a fungal. Okay, onychomycosis usually will be a fungal infection, right? Fungal onychomycosis, usually with dermatophytes. Okay, dermatophytic infection, usually with trichophyton species, either mentagrophyte or rubrum. Remember, the word rubrum means red colonies, and that's why it's called rubrum. Okay, red colonies on culture. Okay, that colonies on culture. Clear? Okay. Okay. Fourth question, please. A 65-year-old old person, right? Old elderly, would have a chronic UV light exposure by that age. Now has lesions on the the word nasolabial is a clue to BCC. The commonest site for BCC is the nose and nasolabial area. A local erosion, which means the symbol for rodent ulcer, rodent ulceration, rodent ulceration, right? And that has to be BCC. You can see a lot of these basiloid cells. These are called as basiloid nests, right? Basiloid, basaloid. Oid means like. They look like basal layers, right? They look like basal layers. So obviously a straightforward thing. Now SCC usually would be an induration, मतलब hardness. Okay, it will be usually a mass cauliflower exophytic growth, है ना? Melanoma would be a pigmented lesion. So none of them seem to fit in the bill. Okay, clear? Okay, seems to be a straightforward question, please. Okay, a patient of leprosy presents with painful lesions rather, around the eyes and center of forehead as shown. The likely nerve involved. Now this was again those gray zone questions. Okay, now gray zone questions here basically means that the lesion was on the face. Now whenever you have a facial lesion, right, like a cheek lesion, right, or around the eyes, now you could look at either trigeminal, facial, both seem to be correct options. I will not say any of them are wrong, but the question is which is more correct, which is less correct. Now usually facial lesion is always involved if there is any lesion, okay, close to the eye. Okay, because it seems that those zygomatic branches seem to be more commonly involved. So if I have a skin lesion, okay, which has leprosy, okay, in the skin, so let's assume these are leprosy bacilli. Okay, there's a facial nerve twig. Okay, there's a facial nerve twig very close. Okay, so this bacilli will usually be also be found in that area. Okay, so I'm not saying trigeminal is wrong. I'm saying it's more common for facial to be involved. And this facial involvement then further leads to lag of thalamus, okay, and a paralysis of the orbicus oculi muscle, and that usually is what creates that inability to flicker the eye, and that is usually something that I would push uh, my thing. And then it's always common for this question to be again interpreted in both ways, but again I would put my money, I've written that in class, the commonest nerve involved, cranial nerve, is going to be facial, right? Okay, now lady with a body mass index, and we do so much of this discussion when we do the regular batches at DBMCI. I almost spend 15-20 minutes talking about my favorite topic of acanthosis nigricans, and you know my focus on nutrition and all that stuff, right? So I always make sure that students understand acanthosis in such a beautiful way. Okay, this is obviously an obesity lady, right? And obviously supposed to be insulin resistance, right? Okay. Now, underlying cause obviously is metabolic syndrome. So this is the neck folds. This is actually thick skin and hyperkeratosis. Okay. And this thick skin looks black. Thick skin looks black. So it is no melanin. There's no increase of melanin in this lesion. So no, tyrosine inhibitors don't really work. In fact, what you do is maybe retinoids work for this, or maybe salicylic acid also might work for this, right? Because you have to then thin up the skin to make them better, and that's called insulin resistance or metabolic syndrome, right? Straightforward question. Okay, straightforward question. Okay. Okay. A patient with anogenital warts come to you. Histology shows, okay, squamous cell atypia, right? High risk. Now, when we talk about anogenital warts, when we talk about high risk, there is absolutely no confusion on that. Now, this is going to be the low risk type, okay? This is going to be the high risk type, okay? High risk type. 1 second, please. Okay, so high risk types. Okay, the other high risk types 16, 18, 31, 33, 45, 52, 58. So you have to mug up all these 7 viruses. Okay, and the high risk are called high risk because they have E6 and E7 proteins. Okay, which are the tumor suppressor gene inhibitors. So they are P53 inhibitors. They inhibit the tumor suppressor gene. So obviously their tumors are more aggressive, right? Okay. Okay, now NEET 21 budget. We have through with 23 and 22, now 21. Okay, 21. Okay. A patient presents with paronychia. What is paronychia? See, this is the nail. Okay. Par. The word par means around. So that means there is some problem around the nail. Can you see what I've just shown you? Around the nail. And the commonest thing which creates this is staphylococcus. That creates acute paronychia. Acute paronychia with even pus, sometimes a purulent exudate which can come, and they have an infection pattern which is linear now on the upper limbs. This is actually what has happened is the staph has gone into lymphatics. Staph has gone into the lymph chain of the upper limb, and the lymphatic channels have all become red and inflamed. Otherwise, the red cord-like structure. So obviously for staph, we want to give amoxicillin coupled with clavulanic acid. That should be the suitable question. See, there's going to be 1 or 2 questions in every exam which are going to be weird. Okay, don't worry about it. It's going to be that way. Okay, it's going to be that way. So don't get too hard. As I said, what did I say? I said that you will regret making mistakes in the simple questions. If, for example, this question, okay, if you make a mistake here, then it's not such a big worry. But if you make a error in the gonococcus question or the STD question, that's a worry for me. Okay. A truck driver came with complaints of painless ulcer after unsafe intercourse. Motor of the organism can be best checked. Now, this is again a simple question. This should be syphilis, bache, right? And the answer is dark field. Should be very easy to understand. Dark field microscopy. I don't have to even explain this. The straightforward question, no confusion whatsoever. Okay? All right. A migrant laborer came with complaints of urethral discharge after 1 week of unprotected sexual intercourse. Now, urethral discharge means this is the issue with urethral discharge, which is obviously urethritis. है ना? Urethritis will be usually gonococcal or non-gonococcal. Okay. Now, when we talk about this now, listen carefully. This is usually the incubation of 2 to 5 days. Okay, incubation is usually 2 to 5 days. It's a very short incubation period. Now, whenever you have a short incubation, you look at gonorrhea. Short incubation period, you look at gonorrhea, right? Now, this urethral discharge, sorry, please, 1 minute. Okay, now this is usually 2 to 5 days. Okay, sorry, 2 to 8 days. I'm so sorry on that. 2 to 8 days. Okay, 2 to 8 days. Okay, this will be 10 to 14 days, right? So the way to distinguish that from the other is just going to be the incubation period. Plus, gonococcus is usually going to be a thick pus. The image also shows you a bit of a thick pus, and this is much thinner. We call it mucopus. Muco matlab pus and mucus combined together. So this should be gonorrhea. This is usually non-gonococcal, which we are not considering because it's too fast an onset. So it's within a week, so should fit in the incubation period of gonorrhea. ठीक है बच्चे? ठीक है? Clear? So the answer is gonorrhea. Okay. A biopsy patient of 30 years came with flaccid bullae on her skin, which are easy to rupture. Biopsy is suprabasal. That should be a straightforward question. And this is row of tombstones. Now, my problem has always been that if you make a mistake here, then I don't know who can save you, right? This is where ranks really tumble down. So यहाँ पे गड़बड़ नहीं करनी है. ठीक है बच्चे? Pemphigus vulgaris. Pemphigus vulgaris. There's absolutely no confusion on this, right? It has to be a flaccid bullae, right? Even Pemphigus vegetans has a suprabasal split. Same. Okay? but in vegetarians you would have a cauliflower mass. Okay, a cauliflower mass in the axilla, a cauliflower mass in the axilla. Okay, okay. A girl child will present with rough lesions over her elbows, knees, extensor surface. Now this image is not very clear, but this was an image of some spiny lesions like spines, okay, on the elbow. Again, it's not a direct derma question, it's more of a biochemistry question, okay, right? This is actually called as phrynoderma. This is basically a what we call as follicular keratosis. See the word please. Follicular keratosis, meaning this is the hair follicle. Okay, the hair follicle, let's assume this is the hair follicle. Around the hair follicle there's a hardness, so this is the follicle and a bit of keratin, so that's called follicular keratosis. And on the elbow they can have this spiny projection, that's called phrynoderma. This can have a bit of vitamin A deficiencies, B complex deficiencies, vitamin C, vitamin E, fatty acid deficiencies. Multiple nutritional deficiencies have been known to create this phrynoderma, also called as toad skin. So this should be what you would answer as a phrynodermic thing. Okay, right. A male child complains of mild, painful, boggy. The more boggy means it finishes your question or carry on. 3 months. Okay. Pet animals. Pet animals. Now, why pet? Because many times you have anthropophilic organism. Give me 1 minute, bache. Give me just 1 second. I'll be back in 1 second. Yeah, okay. Sorry for that unnecessary hold. Okay. Now, mild, painful, boggy swelling in the scalp for 3 months. So, anthropophilic means there are three types of anthropophilic, zoophilic, and geophilic. Okay, these are the three types of tinea. Okay, three types of dermatophytes rather, depending on where they would come. Okay, dermatophyte. Anthropophilic means they come from humans. So it's a human to human transmission. Zoophilic means it comes from animals and pets. Geophilic means it comes from soil. Okay, comes from soil. Okay, so what we know is this, the question says pets, so that is what you would kind of look at, है ना? So usually the carrion is caused either by the trichophyton species, or it could even be caused by the microsporum. You don't have to remember the organism because there are multiple organisms which can cause the carrion disease thing. Okay, clear? Clear? Okay. The moment you say boggy, there is no differential for a boggy swelling. Okay. Usually you will find that carrion will have always a mention of boggy swelling. ठीक है बच्चे, everyone? Clear? कोई confusion नहीं है, hope, है ना? All right. Right. The last question then. A 45-year-old farmer has a foot swelling and sinus. Microscope of the granule is as shown. Now this microscopy of the granule is as shown. Okay. Now listen to this. Pick the correct statement. Okay. Now it has foot swelling, it has sinus, and the granule is mentioned. So obviously the moment the granule, remember that mycetoma thing. So this is the grain, okay, which is actually a histopathology of the grain. Pick the correct statement. Pick the correct. Pick the correct statement. 1 second, please. Okay. Now, see, remember this Splendoropoly phenomena is seen in what? Sporotrichosis, right? Sporotrichosis, right? Which is going to be something like this and here and here and here and. But sporotrichosis has no grain. So I don't want to think of this. Now I told you that mycetoma, if you remember, okay, is hematogenous. No, it doesn't get to hematogenous, right? Does it invade? Does not invade the deeper? It does. Remember the bone involvement, I told you the osteolytic lesions, right? Obviously the answer should be actinomycotic mycetoma, and eumycetoma should be what? The only, see, you might not honestly be able to identify the histopathology. But again, just look at this. Now, can it cause a granule? No, it doesn't cause a grain. The grain is the biggest clue to this question. So can you see it needs a bit of concentration in your part, because you might say, oh, this is the asteroid body. You might kind of mistake it for that, and you might say asteroid dikh raha hai, chalo sporotrichosis, Splendoropoly. But then again, see, again, this is what we need to know, that many people can make an error even though they know the topic. They can make an error in the final judgment because they choose to focus on the grain, which is not, they choose to focus on this which looks like an asteroid, but it's a grain which was biopsied, and the moment the granule says, you don't have to do anything else. It has to be a straightforward question of mycetoma. Okay, bache? Understand, please? Okay, so that finishes the 3-year questions. That finishes the 3-year questions that we wanted to do. Okay, so we have been able to do a good discussion on the questions. So you can see on an average, we're looking at about 8 questions. And if you look at primary dermatology in the NEET exam, right? And if you kind of couple with biochemistry, couple with microbiology, you might find 10 or 12. But then usually that's an overlap between micro and sometimes gynae gets overlapped with dermatology. That's all there. But a primary dermatology is usually going to be all of that, right? Okay, right. Okay, so that finishes, bache. Whatever I wanted to do, all of you have my utmost blessings and my heartfelt blessings for this often very difficult stage of your life. And I'm here to tell you, I acknowledge that this is difficult. I acknowledge that you're fighting. I acknowledge that you're still standing. And you will then have my respect, okay? Because you are still standing in spite of this very, very harsh time. It's almost like a wind, which is almost a hurricane in your face, and you're trying to stand and hold on to a pole, hoping that this wind doesn't blow you away. But one thing I can just tell for all of you is, और मैं इसका पूरा तहे दिल से विश्वास करता हूँ, सबका ना कुछ लाइफ में अच्छा हो ही जाता है. वो अच्छा किस तरीके से होगा ये हमें नहीं पता, ये आपको भी नहीं पता. Destiny will not reveal its cards, and you are not here to guess कि मेरे तरफ कौन सा पत्ता फेंका जाएगा. I don't know. neither do you. मुझे नहीं पता कि मेरी लाइफ में क्या होने वाला है. So what life never gives you is certainty. Learn to live with uncertainty. I think that's the biggest thing I can tell you, because I've always been taught that if you work hard, then things will come your way. But that's not really true. I've had so many students who have worked so hard, but they have said, "Yaar, kya pata nahi mujhe kya ho raha hai? Why am I not feeling confident?" What I have to understand is you are looking for certainty. No, life doesn't give you certainty, right? You understand, please? You have to know one thing, that it's all a game of effort. And I say this on all my classes. In the next 1 month, next till the NEET exam, the only thing I want from you is what I call as 100% effort. Now just go back to today, from morning till night, right now. How many of you, and give me a number on this, how many of you can tell me, how many of you can tell me कितना परसेंट एफर्ट आपने कितनी ऑनेस्टी से दिया? Can you tell me I did my work today with 100% honesty of effort? I'm not talking about how much are you remembering. I'm not talking about how many MCQs you have solved. I'm just asking you in your own heart of hearts, can you give me a number कि कितना परसेंट honesty से आज आपने काम किया? क्या आपने 70% honesty से काम किया? क्या आपने 100% किया? In the sense कि इससे ज्यादा तो मैं काम आज कर ही नहीं सकता था. इससे ज्यादा I could not have worked harder than what I've done today. if you can tell me that कि आज तो मैंने 100% किया, इससे ज्यादा तो मैं कर ही नहीं सकता था, you have my respect on that. I don't respect students who come first and second and third and fourth. No, that's not the thing for respect. For me, the respect is for someone who has done 100% honesty of effort. So the results are never in your hand. जो first भी आया, when we interview person who's going to be first, you ask him, did you expect this first rank? He says, no, I just did my effort and it was a surprise that I came first. Imagine somebody who's come first also cannot predict his results. So why are you talking about मुझे अच्छा रैंक मिलेगा कि नहीं, अच्छा रैंक मिलेगा कि अच्छा रैंक मिलेगा? आपको नहीं पता आपको क्या रैंक मिलने वाला है. The only thing which is completely in your hand is how much effort you can put into a day. Divide this next number of days. आपके पास जितने भी दिन बचे, आपसे मैं एक ही वादा चाहता हूं कि अब रात को जब सोए तो you give yourself a pat on the back only if you have made 100% honesty of effort. मैं ये नहीं कह रहा कि आपको 10 घंटे पढ़ने की 12 घंटे पढ़ने. आपको ये बोलना है कि इससे ज्यादा मैं आज नहीं कर सकता था. If you're having migraine, you can only study for 4 hours, no problem. You say कि 4 घंटे से ज्यादा आज मैं कर ही नहीं सकता. I'm happy with that. What we know that you will find that you will feel lost. In this next few days, you will feel as if you're in the middle of the sea. कि आप drown कर रहे हो. You're drowning and nobody is there to help. You know what? Who's the biggest help? You have that inside you. वो आपके अंदर ही है कहानी, वो आपके अंदर ही है जज्बा, वो बस दब गया क्योंकि you're looking for outside help. Come to me, meditate in the next 20 days. Don't think of that 15-minute investment as a waste of time. That might be something that actually improves. Okay, go near someone who's going to support you. Go near someone who's supportive and giving you positive thoughts. क्योंकि आपके तो अंदर नेगेटिव थॉट्स ही आ रहे हैं, कोई और तो होना चाहिए उसको बैलेंस करने के लिए. I'm a big fan of 2-hour sessions. 2 घंटे तक पढ़ाई करनी है, 5-10 मिनट का ब्रेक लेना है, फिर 2 घंटे की पढ़ाई करनी है. I'm a big fan of this. And then if you do this like 5 sessions per day, 2 hours each, with actually a bit of 10-15 minutes break in between, it will do wonders to your preparation. Don't look for 4 hours at one time. It's going to exhaust you. Do 2 hours, break. And in that break time, don't scroll on the mobile. Close your eyes and breathe. Breathing is the most underutilized skill of humans. Breathing is when you retain whatever you have read. So the retention of memory, it's almost like like your pressure cooker के ऊपर जो ढक्कन होता है, you have to keep things inside. So your relaxation of 15 minutes is that lid. You're going to be actually doing this, and this is really something that really helps you. Okay, so join my Telegram group, right? Dharma by Dr. Saurabh Jindal is the name of that Telegram group, and I do daily meditations for all of you, 9:45. Sometimes I also come at the end and give you some motivation, right? And this meditation session is free and something I do all the time so that my students get benefited not only from my teaching but also from my holistic understanding of what success in life actually means. ठीक है बच्चे? चलो. So with this, I will close. Thank you so much for your time and your attention.